Hi, good day. My name is Olawumi Naomi. I'm a 300 level student of National State University, Kefi, presently on my service in an hospital in Abuja here. I've been given this platform by the Nutrition Society of Nigeria to present a paper on a topic themed bridging the malnutrition gap, nurturing multi-sectional commitment for sustainable nutrition in Nigeria. First of all, I would like to tell you what the Nutrition Society of Nigeria is about. The Nutrition Society of Nigeria is a society of nutritionists in Nigeria. Nutritionists are experts in nutrition, whereby they help you, they motivate you and tell you what to do to maintain a healthy life and a good nutrition. Nutrition is a very key factor in maintaining a healthy life and keeping ourselves alive and to have a good way of living so as not to suffer unnecessary diseases which can be properly managed. Now, in presenting my paper, I really want to appreciate this association for giving us this platform. I'll be presenting this paper on bridging the malnutrition gap. This is very important for us to know as citizens of Nigeria so as to help our government and ourselves to boost our nutrition. First of all, what is malnutrition? Malnutrition is an imbalance which can be excessive or inadequate of nutrients in the human body. It can be over or under or micronutrient deficiency. There are two categories of malnutrition. We have undernutrition and overnutrition. Undernutrition is inadequate intake of certain nutrients into the body, which can lead to conditions such as stunting, wasting, and micronutrient deficiencies. Overnutrition is excessive intake of nutrients which can cause an imbalance, causing conditions like overweight, obesity, and diabetes, or even non-communicable diet-related diseases. Now, there are various causes of malnutrition. I'll be listing quite a number of them. One of them is poor maternal health. During pregnancy, it is important for mothers to know the importance of good health while they are pregnant in the life of their children. Poor nutrition during pregnancy can lead to low birth weight or even child death right from childbirth. We have ignorance. A lot of people are ignorant of the right way to eat. Some people are not malnourished because they don't have money or the food at hand, but they prefer to eat quantity over quality. But we should know that to maintain a good nutrition, it should be quality over quantity. Another cause of malnutrition is diseases. There are different diseases and conditions that can lead to malnutrition. One can be loss of appetite or difficulty in swallowing, which is a form of dysphagia. This can cause inadequate intake of food, which can cause to an imbalance, which is most likely low energy intake, which can cause PEN, which is protein energy malnutrition. We have poor lifestyle and social choices. Some people live sedentary lifestyles whereby they are not active, they don't use their body, and they consume a lot of energy, increasing their calorie intake and not expending as much calories. We also have overpopulation. Overpopulation can cause food scarcity. When the population is high, food will be scarce and individuals cannot get as much food necessary for a healthy nutrition. And that causes restlessness and sleeplessness. When people are unable to sleep or they are unable to rest, they begin to crave foods, which are mostly sugars and fats or high sodium foods, which can cause high calorie in the body. War and crisis. When there is war, there is always destruction, which affects the economy and even the food available for individuals to consume. Another cause is war and crisis. In cases of war and crisis in a society, there's a lot of destruction on their farmlands, their livestock, and even the environment as a whole. So this can cause a lot of food scarcity and lack of affordability for individuals, and it will cause inadequate food in circulation for individuals to consume, which can lead to undernutrition in most cases. Now, there are ways in which malnutrition can be prevented, and it is important for us individuals to know this so that we can put them into our lifestyles every day so as to boost our nutrition for a healthier life. One of these ways of prevention is energy balance. It's important for us to know the amount of energy you take in. When you take in a certain amount of energy, you should be able to expend almost as much energy so as to avoid overnutrition, which can lead to obesity, overweight, or even diabetes. Education during and after pregnancy. It is important for mothers to know that during the gestational period, this plays a very key and vital role in the life of the child and the mother as well. Poor nutrition during pregnancy can affect the child and be very detrimental to the health of the child and the mother as well. Food security. Food security is very important. If our food is not secure, that means at certain times some food will be out of season and then they will not be available. And in those periods, that nutrient is not available for individuals. So it's important for us to be able to secure our food so that at all times during the year, food will be available. Family planning. It is important for every family to know their financial capability and be able to give birth to children that they can afford to feed well. It's not about feeding, it's about feeding well. The ability to feed well also can be affected by your family income. When you know how much your family can afford, how many more they can afford to feed, this can help to plan and know how many children should be added and the size of the family as a whole. Nutrition education. Every individual is supposed to have at least a basic education on their nutritional value of their life, from carbohydrates to proteins, fats, minerals, and the likes. It's important to know how to make your meal adequate, even if not as balanced. An adequate diet is preferable, but we know balanced diet may not be easily achievable, but that diet should be at least adequate. Now, in bridging the malnutritional gap, there are different interventions and different sectors that can be involved in bridging this gap. One of these sectors are the education sector. One of the responsibilities of the educational sector is the intervention of providing school meals to boost nutrition. In an environment where certain nutrients are deficient, the school can provide meals for children in school so that these nutrients that are not made available can be made available in the food that are provided to the children. Education sector can intervene in bridging the malnutrition gap is using the school as a platform for nutrition education and other related services. They can provide deworming services, supplement services to students in school so that they can easily reach out to them in order to bridge micronutrients, especially in order to bridge the micronutrient deficiency. Health and nutrition sector. The health and nutrition sector can play an important role in bridging the malnutrition gap. One of them is by providing improved healthcare facilities. If there are good healthcare facilities from the community, national, state levels, individuals are easily able to access healthcare when they find themselves caught up with malnutritional problems. Statistics have shown, according to UNICEF, that about 2 million children are malnourished in Nigeria, and only 20% of these children get medical attention. About 1.3 million children are expected to be acutely malnourished, with 300,000 severely acutely malnourished and the other 1 million moderately acutely malnourished. It is important for us to know that these are very high numbers, and if necessary precautions are not taken, it will cause more damage and the numbers may even go higher. Very big thank you to the Nutrition Society of Nigeria for giving us this opportunity to be able to educate the public on the importance of nutrition, nutrients, and their food eating habits and likes, the important role it plays. This is very important. The steps we take can either make or mar us. It is important for us to know that even after what the government can do for us, we individuals must be ready to take that step to boost our lives and help our nutritional status. Thank you.